I want to look first at the projected fatalities. As you can see from the graphs that are next to me, Illinois is now looking at a peak or plateau of deaths per day somewhere between late April and early May. Why a range instead of an exact date? Well, everyone wants to look at the median line as a guide, that nice clear line that cuts through the big shaded section on all the models circulating online. But reality is not quite so simple. Look at the actual deaths from the past few weeks on the graph next to me and look at the median projections going forward. Reality swings up and down, sometimes drastically, a fact that can't be captured with a simple median line. What we have to consider is the whole shaded area. That shaded area shows the range that researchers are 95% confident that things will land. That's a shaded area you would see in differing shapes on every model. To be clear, the fact that the variance is large doesn't make a model less useful, but it does nevertheless make it clear that it is only a tool to be used. I worry that people think the model is some miraculously accurate view into the future that is going to tell us exactly what we need to do and when. It's not. It won't. I guarantee that the model that we're sharing today will change in the coming days as projected numbers about those days are replaced with actual numbers. A model is an imperfect tool that we use to add context to the actual numbers that we can chart every day: cases, fatalities, hospitalizations, positive test results, ventilator and ICU usage. I also want to explain a bit about this change in our estimated peak cases. The concept of flattening the curve only just entered our common vocabulary in the last few months, and it's really crucial to understand our approach. Weeks ago, many models, both those produced by our in-state experts and those from around the nation, predicted an early or mid-April peak for Illinois. But as the weeks have progressed, those models have come to look quite different. That's not because those models were bad models. Instead, it's because their inputs got better as time went on. Real-time data came in, and importantly, Illinoisans protected each other by staying home. Human behavior is exceptionally difficult to measure and even harder to predict. So that last part about staying home has made all the difference in our progress. Also, and this is very important, the most sensible and responsible use of a model in a public health crisis like this one is to pay close attention to the worst case scenario. In other words, when building hospital beds, purchasing and acquiring PPE and ventilators, and making decisions about mitigation efforts, public officials should assume that the worst end of the model range could happen and take that into account in planning. A pushing out of our estimated peak is a natural consequence of, it's a natural consequence. Pushing out that peak is a natural consequence, and the best indicator that we are flattening the curve. That's what you're aiming to do: slow down the rate of transmission, which leads to a slower rate of increase over a longer period of time, hence a later and lower peak. Pushing the peak further down the line might not sound like good news, but I promise you, it saves lives. And make no mistake, Illinois has saved lives. By staying home and social distancing, we have kept our infection and death rates for the months of March and April thousands below the rates projected had we not implemented those mitigation strategies. The good people of this state have allowed our healthcare professionals the ability to treat patients to the best of their ability without having to make dark choices, very real choices that doctors in other countries faced about who lives and who dies. That is a historic and heroic act carried out by all of you. Your efforts to protect your families, protect your communities, protect each other have also given us another tool, and that's time. Time to build up our hospital capacity in terms of beds, ventilators, and healthcare workers. Time to prepare for the kind of surge that could occur any time as a result of a virus from which no one is immune. And capacity we built. In August of 2019, back in a world that had never heard of COVID-19, Illinois had an average of about 26,000 total hospital beds available. As of today, our total bed count in existing hospitals is more than 31,000. Back in August, we had about 2,000 ventilators. That number is now more than 3,200 ventilators. And we're building our healthcare workforce too. There are now 5,000 out of state and former medical professionals who have applied for temporary licenses to join Illinois' fight against COVID-19. We've built up our hospital capacity significantly. But if we let up now, we would have nowhere near the kind of hospital capacity that we would need. The projections are clear. If we lifted the stay-at-home order tomorrow, we would see our deaths per day shoot into the thousands by the end of May, and that would last well into the summer. Our hospitals would be full, and very sick people would have nowhere to go. People who otherwise might have won their fight against COVID would die because we wouldn't be able to help them through. No amount of political pressure would ever make me allow such a scenario for our state, our beloved state of Illinois. So the numbers present us with only one choice. Next week, I intend to sign an extension of our stay-at-home order with some modifications through Saturday, May 30th. To everyone listening, we are in possibly the most difficult part of this journey. I know how badly we all want our normal lives back. Believe me, if I could make that happen right now, I would. But this is the part where we have to dig in, and we have to understand that the sacrifices that we've made as a state to avoid a worst-case scenario are working, and we need to keep going a little while longer to finish the job. On a more optimistic note, my team and I are finalizing the next step principles for safely moving toward reopening in phases. We are making progress building out testing and launching our contact tracing initiative. So that is so important to us that over time we will be able to realize the new normal, and we can be ready. We'll be sharing more on that in the days and weeks ahead. On another optimistic note, May will look somewhat different than March and April. Since implementing our original stay-at-home order, I've listened to Illinoisans across the state and elected officials of both parties and business leaders, and I've continued to consult with doctors and scientists and experts here in Illinois and across the world on how best to keep our people safe. My intention, as always, is to put your health and safety first.